The Democratic Alliance is warning that the fight against corruption in hospitals is going nowhere. Gauteng DA's Jack Bloom says the provincial Treasury has raised the limit for hospital purchases. This means the purchases can be signed off by the hospital CEO without going to tender from 500,000 Rand to 1 million Rand now. That's the limit. This after Gauteng Health MEC Ndima disclosed that hospital purchase limits increase in her oral reply in the legislature. Masibolekwe maintains that Gauteng Treasury raised the limit to reduce turnaround time and account for increased costs. Let's unpack this further now with the Gauteng Health Department's acting Chief Financial Officer, Masibolekwe Ndima, who joins us virtually from a rather chilly Johannesburg tonight. Thank you so much for your time this evening, Masibolekwe. There's been quite a bit of reporting around this exchange, both from the Democratic Alliance's side as well as the answers given by the Gauteng Health MEC. I've read, however, that this is a decision that was made at national level and it's now being filtered down and implemented at provincial level. Can you explain to us how that decision was made, how it gets filtered down, and what impact that will have now on the work that both the hospitals do and indeed what you and your department in the finance department will have to do?
Yeah, good evening to your viewers. I think I'll just to answer you. This decision was effected on the 1st of July 2021, and I think the National Treasury was looking at a number of things. One being the inflation on the items or goods or services that are procured by government departments, and also the fact that to avoid things like your split cost, because you'll find one item is spread across to be multiplied to get use the threshold, which is not a good thing. So I think it was brought to actually give a sense of ensuring that we actually buy and cover the issues around the inflation and so forth, because it has been seen for quite some time, and there was a number of consideration on the 500,000 that it's not as sufficient as it would. If you can see how the government operates, anything that is above the threshold of 1 million must go to a tender, which is it also has its own period, which is 3 months and so. So I think this was made to ensure that we procure goods and services on time at a variety that we want. Thanks.
One can understand that that is a massive need. If you speak to anybody who works in our government hospitals, making sure that they have the right amount of resources when they need it most, especially when it's a life or death situation, is extremely important. But I'm sure you and your department, I'm not sure when you were appointed as acting Chief Financial Officer, you also don't operate in a bubble, and you're dealing with a department, a health department in Gauteng, that has very much been in the news for all of the wrong reasons, and then one of the major reasons being corruption. Split billing has been a major way in which a corruption has been able to take hold at a number of hospitals across Gauteng, admitted even so by the health department, who said they're aware of these issues, a number of cases being investigated by the SIU as we speak. It does place you, however, in a very difficult situation in that you want to do the right thing to make sure that these hospitals get these resources. But from a monitoring and accountability point of view, you do understand that it is very difficult when you're dealing with a state of play where you've got a number of bad apples that over the last few years has abused those processes to fill their pockets.
Look, I'm really, you're making a big point. I'm trying to establish your question maybe I may answer.
I'm trying to understand whether there is an understanding from the health department's point of view, and especially in your department in finances, where you have to do all the checks and balances and make sure that all the I's are crossed and the I's are dotted and the T's are crossed. That you understand that even though this decision to increase the limits be handed down by from national level, you are working within a department where these limits have been abused to fuel corruption. Is there an understanding that you can't just implement these things without realizing that your monitoring has to be even better than it's been before? Because quite frankly, that monitoring didn't exist. And that's why wide-scale corruption was able to take place at various hospitals across the province.
Okay, this is what we have done as a department. We have actually, I think I understand your question. So what we've done is the department to ensure that there's proper monitoring to avoid the abuse of this increase to the limit on the request for quotation. Anything that is 500,000 and above, any hospital or institution that is procuring that particular transaction has to be verified by our provincial treasury and prior to its approval by myself. So we have put two ways of monitoring. One is this verification by a provincial treasury. When it comes, I also look at I also apply my monitoring. And one of the things that we have done as a department is to enforce hospital to ensure that there is market analysis to each and every transaction, so that we can be able to see that these 500 to R1 million or R1 million transactions are indeed on the market, actually at the market value, unlike somebody that is actually doing these things and ensure that everything that is procured by a hospital is at R1 million. So we are doing these two processes whereby a treasury will also verify that particular transaction, and us also prior to the approval and payments, we do look at all balance and checks are there. Has the CEO checked that there is a market analysis was done, there is a competitive bidding on this, is this the actual price that the market is requiring for these services? From then we'll base our reliance on that as monitoring and then approve. So one of the things that we do also, we have formed what we call quotation adjudication committees. They further, in fact, they are the first layer of first defense to actually avoid split billing, whom they look at these things to say, have we done a market analysis? How much is this product on the market? And confirm budget and all of those things. Then it will go to Treasury. From Treasury, it will come to myself, whom I also do my own balance and checks. So we have put three monitoring mechanisms that were not there at the time to ensure that we avoid this particular conduct.
Does this mean that it would be more difficult for an individual, like, for example, a hospital CEO, to be able to sign off on rather substantial amounts of money?
This is R1 million. It is a limit. And it's something that we always preach, issuing circulars. This is a control that we actually supporting the hospital CEO by establishing these quotation adjudication committees. So what we want is that the hospital CEOs must apply their mind and ensure that the particular transaction is actually in line with our SCM policies and the prescripts. Now, to answer your question, will it be difficult for him or her to actually do? We, as the department, we have not, when people are appointed based on merit and as professional. So we then believe that if you are in the position of a CEO, you are an accounting officer, and you must take a full responsibility of that process. So I believe that we do not have people that we put them there and those people we regard them as corrupt officials, not unless they are proven otherwise. But as we operate as the department, we ensure that there's necessary people that are there, have necessary skills, and they have got support and control mechanism to do their work. So I believe all our CEOs do understand their delegations and they know what to do. And all we can do as a department is to ensure that the monitoring mechanism that we have put there, they are effective. We also have our own internal control unit that conducts from time to time suspicious transactions of a similar nature.
I do understand it must be very difficult when you're dealing with a situation where through media coverage and investigations by organizations or departments like SIU, it's turned up that there are certain bad apples in the leadership of the hospitals in a province like Gauteng, and you cannot paint all of the CEOs or all of the leadership of our health institutions with the same brush. However, I'd like to ask you if you believe that the attention that's been put on trying to root out corruption in your department, and hopefully that there'd be ramifications and repercussions for those found guilty, do you think it will have a positive impact in that we'll see a improvement in how money spent in the Gauteng Health Department is monitored and kept in check?
Look, this a problem that we have is not a problem that was manufactured a month or 3 months ago. It has been a culture. So as the department, through the guidance of our MEC, one of the first things that we've done is to ensure, one, that the culture or the practice or the conduct on how to handle and transactions of SCM or procurement is actually clear, and we're ensuring that it's changed, that the department is not a place where people feel like they want to make some money, they go to the department. Now, I believe, if you are asking my beliefs around the justice system and the law agent system, like SIU, I believe that they will be able to do a right job, and I believe that their recommendations are clear as to what we need to do as a department. And as a department, we are actually busy implementing their recommendation. And I think by implementing their recommendation, examples will be made. And we hope that from then a positive outcomes will be there, where people will realize that health is not a playground for corruption. And I think by that as a starting area, it will assist us to move to a good governance and a good cultural practice when it comes to procurement. So if you were to ask me for my beliefs, I believe in the system, but also we must not forget that these reports, once they are done, charges are formulated. And when charges are formulated, people must be charged formally and disciplinary actions must take place. That also must be given time, because it's not something when SIU issues a report, which is the treatment that we've been receiving, that when a report, whether it's an internal audit or forensic or SIU, results must be there. We also need to apply, because you don't want to be in a situation whereby the very same report is challenged, or you are also getting a backlash based on a technicality because you have not applied what the Labor Relations Act requires when it comes to conduct like this. So we believe that the culture will change because we're doing a lot. There's a lot of strategies. Besides training, there's a lot of monitoring that is going through, especially to our SM practices. So we believe the culture will change as time, but unfortunately, certain things cannot change immediately. And some of the people that were involved, others are left, and there's quite a lot that is happening, but we believe in our system and in our HR practices that where people have been found wrong, examples will be made, and in that way, things will change for the better at the Department of Health.
Okay, we can only wish you and your team everything of the best. That's the Gauteng Health Department's Acting Chief Financial Officer, Masibolekwe Ndima, joining us virtually from here in Johannesburg.